And we are live. We are live. Greetings, friends and followers. I am Dale. This is Nurses Talking Live. And I am so glad that you're here today. So, it is February. It is National Heart Month. And it's a time when we talk about awareness of heart disease and heart health. Today, we're going to go a step further. We're going to talk about readiness because, when it comes to cardiac events, seconds matter and preparation saves lives. And so today, I am very, very, very pleased to welcome Dr. Susan B. Davis. Dr. Davis is the founder of Rescue RN. She's the creator of Code Prep RN. These are two innovative programs that change how healthcare teams prepare for resuscitation before the code team arrives. And she says this is like moving them from a completed training to confident performance in the first critical minutes. And drum roll, Dr. Davis is also an American Heart Association Woman of Impact nominee for this year, 2026. She's recognized for her leadership and commitment to improving cardiac outcomes. So, welcome, Dr. Davis.
Woohoo! National Wear Red Day. It's the kickoff for the competition / Women of Impact. Thank you, Dale. How cool is it on this kickoff day to be here with you? I'm loving it. Thanks so much for having me.
I'm loving it too. And I'm glad you said, let's start with you. I'm glad you said let's wear Red Day. So briefly, now that you bring that up, so why Wear Red Day?
So, this is Heart Month. This is the time when we have an opportunity to bring a lot of awareness to heart health, and specifically, heart health for everybody, but we're going to twist the angle a little bit and talk a little bit more about women's heart health. So this is a National Wear Red Day. Yes, or I guess around the country right now, they're doing their Go Red for Women luncheon, kicking this off. And it's really to bring awareness to women's health, both cardiovascular health, heart attack, acute cardiac arrest, stroke, all of that. And so they're saying, lots of times you think of red as in stop, and the American Heart's saying no. Red means go. Red means go. So we're going red for women. We are launching today this competition. It's a 9-week competition, and it's really each week. Literally, we're only talking about the next 9 weeks for the Women of Impact campaign, but it's every week of the year. The American Heart supports us every week of the year with personal challenges and things that we can do as women and as mothers and sisters and cousins to share the awareness. So you and I were talking just before the show, and we were like, how can it be the number one cardiovascular disease, heart disease, the number one killer of women, over all of the cancers combined? And I don't know how much I talk about it as a nurse.
I don't talk about it much.
How is that possible?
How is that possible? And as you ask the question, you talk about it being, the number one killer. And I just said, I don't talk about it much. And as I said that, I thought of one of the reasons that I'm wearing all this red today. Listen, I got carried away. Bracelets, rings, earrings, I got carried away. But one of the reasons that this particular day means so much to me is that I have someone very, very, very close to me who is, I say, a heart warrior. And so why am I still not talking about it much?
Isn't it something?
Yeah.
I think, I don't know. I think lots of times in my world, we say CPR. It's super important, but I think words lose meaning if we don't connect story, if we don't connect it to your heart warrior, if it's not your mother or your sister or your cousin or someone that's had a stroke or who's had a heart attack. And, women, we're the worst. Maybe we don't talk about it enough because we're the worst. We're the worst as far as just keeping on. We just keep on keeping on. We definitely, and you add the fact that we're nurses, you can forget about it. We definitely don't take care of ourselves as well as we could and should.
Yeah. And as you talked about women, we're the worst. First of all, as you said, we really are not taking care of ourselves properly. And second of all, we started off, as far as this heart disease thing, we started off way behind the research. Because remember, all the research was done on men. All right. And so
Yes.
now we're talking about how the symptoms and all of this kind of thing look different for women. But so many of us are not even aware of it. We're still looking at expecting the symptoms that were described for men to show up for us.
I have an elephant on my chest. I've got pain in my arm. Yeah. So no, you know what it is for women? Anxiety, nausea, heartburn, backache. And what do we do? Yeah. And what do we do? Oh, the laundry and or, grocery and or, off to school and or back to work and or, we just keep going until, I teach my patients all the time. I teach students when I'm teaching, horses don't just kick. They give you lots of signs and symptoms. They shimmy their skin, they shift their weight, they swish their tail, they pin their ears before you get kicked.
Yeah.
We need to pay attention to the signs and symptoms.
Yeah. And you just mentioned quite a few of them. So there are two things. I am running around in my head now which question I want to ask you first. I think I'll go with this one first, because when we talk of cardiac events, when we talk of heart attacks and stuff like that, very often we're thinking of people in hospitals, in institutions. But where do most cardiac events take place?
That's a great question to start with. And I don't know why we don't talk about this one either. Everywhere. So 70 to 80%, the numbers vary, of cardiac arrest happens at home.
Yeah.
It happens at home. And then you think about it, and I heard a really interesting statistic the other day from a Project Adam hero. And she said that on any day in your community, take your community, wherever you're listening to this from, 20% of your population is in school. Right? So our children and all their teachers, 20% in the building. So 70 to 80% at home. So we have a huge push right now to teach students, because not only they'll be safe while they're in school, but our students go home. They go home and they're ready and willing to learn, maybe a little more so than us as we age and we get away from the learning zone. So we're putting a lot of emphasis into students at school. But then think about our athletes. So you get that cardiovascular system, stressed a little bit, and watch what happens.
Yeah.
You name the sport. In fact, we have a video coming out that's going to show the real cardiac arrest, because people have a hard time sometimes telling whether it's cardiac arrest or not, because it's very scary. So it happens at home, it happens at school, it happens at your sporting events, it happens during marathons. And then, it happens in hospital. I mean, we're kind of expecting it in certain areas of in hospital. It happens in clinics randomly. People are sicker and sicker, and then they know they know they have an appointment in 10 days, so they're gonna stick it out at home.
Yeah, right.
And they wait, and then our clinics, they're like, Mr. Jones or Mrs. Smith, you're like, they've gained fluid, they're holding fluids, they're not breathing so well, and then we need to send them to hospital.
And then we send them to hospital.
Nobody's, it's fair game, Dale. No, cardiac arrest does not care how old you are. It doesn't care what your job description is. It doesn't care where you live. All it cares about is it's someone around you knows what to do if it happens.
Yeah, exactly. Someone around you knows what to do when it happens.
And that's the readiness. That's where we kind of started.
And that's the readiness. And so that's what you focus on. But now that you bring that up, what does readiness really mean in practice?
That's a good. So, when I talk about this to non-clinical people, I say, okay, so anything in life that you have to do you feel better if you're ready than if you're not? So you're going to take a test at school. Do you feel better when you've studied, or if you haven't studied, right? So if you haven't studied and you're going to take a test, you feel terrible. If you're going to do a little speech, or you're going out to dinner with people you haven't know. I mean, we rehearse things in our mind. The point is being ready feels good, and not being ready feels bad. Now let's add the fact that someone's trying to die.
Right.
So that changes the whole game, right? Not a game at all anymore. Now someone you love is trying to die, and it does. There's discussion about heart attack versus cardiac arrest. So when it's a heart attack, we've got a little time. Even though that body's probably been, that horse has been, shimmying its skin and shaking its tail for a couple days, because we know signs and symptoms of heart attack can start 24 hours ahead of time,
Yes.
8 hours ahead of time, and they're darn sure going to have symptoms 3 hours ahead of time. But cardiac arrest, that's it.
It's like, now.
Are you ready or are you not? So what does it mean to recognize the problem, call for help, and act? No matter who you are, no matter where you live, and no matter what you're doing. And these are children, middle age, healthy people, not so healthy people. It's everyone's fair game. So readiness means more than an idea, more than a conversation. It means if you're ready, you feel comfortable, you and your family have done something more than talk about it.
Yeah.
To be ready, recognize the problem, call for help, and act.
Yeah, exactly. And you mentioned children, and very often we don't think of this in terms of children. You think, when you think heart attack, and the first thing that comes to a person's mind, or cardiac event, is an older person, they're 60 plus, they're whatever. We're not thinking a 5-year-old.
No, and the same gal I referenced just a little bit ago, she started working with the Project Adam, which Project Adam, if you don't know, everybody, is an amazing program. I'm not a Project Adam expert, but they go around the country making sure that schools have the equipment they need. They have an emergency response plan, and they go in there and they help them do this. They want to make sure they have the equipment and the training and the plan. So they're awesome. But she's the one who said that it was a 5-year-old in her child's class. So it wasn't her child, but her child witnessed a 5-year-old having a cardiac arrest in the classroom. So just, I mean, like, how can we not? It's a horrifying conversation, but if we don't have it, that's that whole, we can't bury our head in the sand. I mean, if a 5-year-old in a classroom, can you imagine the teachers? And then how do the other parents deal with the other children that were in the class that witnessed this?
Yes.
Very scary.
Yes. It's very, very scary. Very, very scary.
And scarier if you're not ready and don't have a plan.
You said scarier, and to bring a bit of levity to this, earlier we were talking about, and I mentioned Ralph Cramden of the Honeymooners, and I can see him now going,
yeah. Oh, and that's true. Feet don't fail me now. I mean, but you have no idea. Fight, flight, or freeze is a normal physiological response. I don't care who you are. I don't care if you're the most experienced, paramedic or ICU nurse. We really never know how we're going to personally respond in that moment, if we haven't practiced. Exactly. And readiness is something that must be practiced.
It has to be practiced. And because you talked about, I mentioned before, you talked about going from completed training to confident performance. Because very often we think that if you did the training every year, you're good to go. It's not the same as being ready.
It's so not the same. And it's every 2 years. So, back in my graduate work, I studied responses all over the world. What are they doing? How much time are they spending? Blah, blah, blah. What does it look like? And, the research shows that, people don't learn very well in classroom settings. Well, that's not true. They do. But the bottom line is we lose. People remember 30 to 2. I think I remember 30 to 2. But they forget it like 3 weeks after class. So now 2 years later, it's time to renew. And it's been a long time. And you haven't seen a code. You haven't been part of a code. No one in your family has had an incident where you've done compressions, or you've recognized the problem, called for help in any manner over a 2-year period. And now someone you love has dropped in front of you. They're not responding. They're definitely not breathing normally. What do you do? Oh my gosh. I mean, that's like, you got to act, and we got to know what that is. So you have to practice. So the point of that is in the defense of all of our foundational education, whether you're in healthcare or not, they've always said that this is foundational learning. Please go home and practice with your team, with your equipment, and in your space.
Yeah.
In your home.
With
your team and your equipment and in your space, whatever that means. And so that's what it is. You got to practice.
Yeah. So many of us, I don't know. We skate along. Oh, but I was about to say we skate along and not want to do that at home. And it occurs to me as I started to say that really home, I guess home is supposed to be a safe place. And as we start bringing things into that kind of thing into the home, we're saying maybe it's not so safe.
Well, think about it. Think about people they call 911. Why? Because there's an emergency in their home and
Yes,
they're
yes,
waiting
I
for help
know.
to arrive. So like waiting here is when we say this, waiting for help to arrive.
Yes.
The most horrifying wait of your life. If you actually you call 911, you have a medical emergency in
Yep.
your home.
Yep.
So anyway, you and I talked 2 years ago about the same topic,
Yes.
and I thought that was really cool that you posted that memory. But it's interesting because of course I'm still working in this field, both in my day job and in my my
Mhm.
side gig, which is whatever it is, all encompassing because there's no stopping.
Yeah.
And the more we talked about a couple years ago, we said, because I was so focused on hospital, and then it was outpatient, and then it was imaging, and then it was like, wait a minute, our community, wait a minute, our home. So now it's totally fun because I'm launching into Rescue RN Global. And what does that mean? It means, well, everybody in any home, in any setting
Yes.
qualifies.
Yes.
So I'm hoping to have some of this worked out by summer at the latest, but Rescue
Mhm.
RN has a global and home, Rescue RN home.
Yeah.
So that's gonna be very exciting. And it's my same program that I use for hospital and clinic and everybody. Just the words are adapted, but it's the same thing.
Yeah.
Recognize the problem, call for help, and act.
And
And then really gonna be working with people so that they can get maybe AEDs in their homes too. So
and then
I'm doing it.
and do it and do it. And one thing I want people to know is that doing this is I know it's scary. I know it's scary, but it's also empowering. When
Very.
you've done this, I did I taught my husband CPR and that kind of thing, and all of a sudden he's an expert.
Of course.
but it's amazing to see how empowering it can be to have that feel of being confident, of knowing what to do. You don't have to know every last thing there is to do. You just have to know how. Just keep me going until help arrives, and what to do.
Yeah.
What's the best way to do that?
Hard, push fast. Push hard, push fast. I teach no. There's all kinds of acronyms, and there's so many people doing wonderful work in this field. And I kind of mash their different slogans together depending on who I'm talking to. But I teach the no go even in the hospital.
Mm.
Are they responding? No. Are they breathing normally? No. Go. It's time to go. Push hard, push fast. There's a
Yeah.
reason the American Heart came out with, friends and family a hands of years ago, because you're likely to be surrounded by your friends or family. And what
Yeah.
do they teach? They teach hands-only CPR. The Citizens CPR Foundation that I'm an advisory board member for. We help municipalities, cities, and counties across our country become heart safe. There's 13 parameters to becoming heart safe. And one of them is 15% of your population has to be trained in hand-only CPR. Why? Because it works. Like I keep telling everybody, you just need your hands, your eyes, and your brains. Recognize the problem, call for help, and act.
And
Your best compressions, and grab that AED, electricity, if you have an opportunity.
yeah. So I want to move just a little bit and talk
Okay.
about this nomination that you have, American
Okay.
Heart Association Woman of Impact nominee. First of all, I want to know, what does it mean to you personally, and then how is that going to connect to your mission?
So personally, I've worked with the American Heart Association for a very long time, and to be recognized by them as a woman of impact, period, to have anything to do with the heart health of women in my community, I was honored. I mean, I'm really honored. And the fact that and Dale, the fact that we don't talk about it, and even with all the work that I do, I know talking about women's health at the forefront. So for me personally, I thought if there was going to be a woman of impact in this field, it darn sure better be me. And it's gonna be me. So it was a little bit of a daunting task to say yes, because it's not a hey, you're awesome. Here's your ticket.
Yeah, we got to earn this.
Yeah, it's yeah, you're awesome, and now let's see what you can do for 9 weeks to raise awareness. And so I take that very, very seriously. I'm very interested in serving my local community, but through some of the work, Dale, that I've done here locally with many other people, not just myself by a long shot, but passing the cardiac emergency response plan legislation in our state of Florida, as well as many, many states across the United States. So as a woman of impact, you can donate to its research, innovation, and education for women's health. That's awesome. But because of my work with AEDs and CPR and helping communities and schools, the American Heart here locally in Southwest Florida, they're compiling lists of schools that have an exact need. Schools and communities. Like they have, right now there's 30 schools listed that don't have enough AEDs. Yeah. So they're allowing me to target my campaign on that. And so I started thinking, I'm like, wow, especially when we go live with you, and some of the work that I'm going to be doing live across the country is hoping to set precedent. Yeah. So that if they want to donate during this time frame, during Heart Month, to another Woman of Impact campaign, that we can make it prescriptive to their schools. So I want everyone to hear that. Like, if you can call through my links and get a hold of it, it doesn't go through me. It goes to the American Heart, and they'll find the school that you want to make sure, like hashtag, put your money where your kids are. Yeah. You got to make sure they have enough AEDs and that they have the plan to use it and maintain them in that whole 9 yards. So it's a big deal. I'm doing my spin on it. I'm doing my spin. Cardiovascular health via, cardiac arrest. Yeah. Rescue RN version.
I was going to ask you what keeps you passionate about this, but you just did that already.
Not to. You know what happens? You talked about it when you talk when you trained your husband. That confidence is very catchy. People are afraid of it, and when you take away all the crazy algorithms and you take away all the fact that no, you don't have to be a healthcare professional by a long shot. Right. You just have to. Like, I teach people, I'm like, do they look sick? Like, we know what sick looks like. They're sick or not sick. We are family members. We have children. You know, when a child has a fever, you know your patient, you know your loved one, like sick or not sick. So I really try to empower people that they know what they're looking at better than anybody. So you can recognize the problem. And then, we do like a green, yellow, red. When you get to that yellow zone is when we get in trouble, because you wait. So I give them really clear cut thumbs up or thumbs down. Like, if there's one thumbs down, I use RPMs, respiration, perfusion, and mental status. If it's a thumbs down, we're not waiting. Okay. That yellow zone is what gets people in big trouble, because if we miss the yellow zone, they're red, and now it's definitely a 911, or it's time to act that no go. Yeah. So try to make it really, when they get it, they're like, that's it. I'm like, that's it. Come on. That's it. You can do this.
So if anyone here wants to join your team, how do they do that?
Oh, very exciting. Very exciting. Thank you for asking. And what does it mean to be a team member? Because I think again, when you're asking for money, it's kind of creepy. I mean, let's not lie. Nobody likes to be, I've never done this before, by the way. So leaning in the best as possible. But when it comes to the money ask, again, we're specifically asking for, well, you don't have to, but you can, like, whatever, a dollar, the amount that adds up to an AED, I'm going to be putting money in to get an AED, or anytime kits for the training that they need at the school, or a full CERP, a cardiac emergency response plan. So that information can be found. You can go to my website right here, rescuern.com. And when you go on my website, it'll pop up to my campaign page. So if you want to be a team member, which would be awesome, because team members help me out immensely, each week starting this Monday, the 9th, if you get on there and you say, yes, I want to be a team member, it will ask you when you sign up to be a team member, it'll ask if you want to set a donation amount. You can pick any number you want if you're into that kind of thing. And if you're not, you can just set it at 0, which is totally fine also. Because every week there's like a 5-minute homework. There's a theme every week for the next 8 weeks, like CPR week, stroke week, do your exercise week. There'll be a theme with just a short little bit of homework. And as a team member, if you do the homework, let's say that week is 400 points. You'll get 400 points for my campaign by just doing the homework. And those 400 points equal $400. So at a minimum, if you just join my team, all you have to do is do your homework, and it'll make money every week, like $300 to $400 every week for 8 weeks. So that's pretty exciting. And then the second part of being a team member is if it lands on your heart and you know somebody who might want to put a few bucks in, share the word. just spread my posts, share my posts. I don't want anyone to feel obligated. Again, I'm probably a bad salesperson and a bad fundraiser. I don't want anyone to feel obligated, because this is about awareness, right? It's about money, but it's about awareness. Mm-hmm. So I'm hoping that over the next 8 weeks, we do have the conversation deal like this. Let's talk about it. Let's talk about that you need your sleep.
Yes,
and that you
right.
Move, and you need to get the best nutrition to keep your heart thumping as long as it's supposed to be while we're on this planet. And that's really what it's about.
Yeah. And it's for me, it's all of that, plus just recognizing, if we just stop for a minute, or for me, if I just stop for a minute and recognize that my heart is working nonstop without any direction from me. Yeah. It makes sense that I need to pay attention to it and give it all the love, because
lots of love. Lots of love. There was a speaker yesterday, and she was a physician. She was a cardio oncology physician. Mm-hmm. I was like, why aren't we talking about that? Like, of course, women have more needs when they're pregnant and post-pregnancy that have any kind of thing with their heart. Can you just even think about that being a specialty? I mean, what a neat conversation that is. That who even knew that was a specialty? So I'm hoping that over the next, during this campaign, that we talk to people like this, there's a such thing as a cardiac, there's cardiac oncologists too. I actually said specialists, because, your heart's pretty involved with all of it. And to your point, it's really about the love. It's really about the love. You got to love on your heart. You got to love on your body. Food made with love tastes better. Food made with love has more nutritional content. Conversations shared with love are heard better.
Yes.
So today it's all about the love.
It's all about the love. Are there any last words you want to leave us with, Susan?
Nope. I just love you all. I love you for having me on this. Thank you for joining me. Thank you for having me. Thank you for wearing red. And, I have no idea where this is going to go, but I really hope that you guys have fun with me. Have fun with me while I go through these next 8 weeks. Please keep that in mind. It is a competition, by the way. And I'm really normally not a competitive person. But I would like to win the nation, rather than just my area. So if I'm going to do this, I did make a really huge goal of $300,000 because the lady who won last year made like 280. So I was like, fine, I'll do 300.
Gotta do better. Mm-hmm.
Now, don't let that scare you, because I giggle at it, right? But when it comes to buying AEDs and equipment, and businesses can sponsor, I can put your logo. I will brag about you. I will brag about you if you join my campaign. I can do a hands-only event. I can speak for people. Listen, I'm in a competition.
You're in a competition. And all our hearts are the beneficiaries.
Yes. So that's it. That's my final word, other than thank you again, Dale. I love seeing you, and what a pleasure to be on your show.
Thank you so very, very much for doing this. I truly, truly, truly appreciate it. And everyone, don't forget to join her team.
Join my team.
Bye.